Hi, Assalamualaikum. My name is Halakil. In this video, we will explain the three subtopics, which is adaptation of respiratory system during exercises, the impact of specific conditions, and the strategies to optimize respiratory function when undergoing specific conditions. Before that, do you guys know what the physiological adaptation of respiratory system? Physiological adaptation of respiratory system are changes that can enhance gas exchange and oxygen delivery in response to environmental challenge. Physiological adaptation of respiratory system during exercises and physical activity vary significantly, especially in athletes. These adaptations are influenced by both the intensity and duration of exercises, as well as specific conditions like exercise-induced asthma, respiratory muscle fatigue, and altitude training. Adaptation of respiratory system during exercise leads to increase in ventilation. During exercise, the body's demand for oxygen increases significantly, necessitating adaptation in respiratory system to enhance ventilation. These adaptations occur through various physiological changes that improve both the efficiency and capacity of respiratory system. Tidal volume. This refers to the amount of air inhaled or exhaled in a single breath. With regular aerobic training, tidal volume increase, allowing more air to be moved in and out of the lung with each breath. The rate of breathing also increases, in which cause breathing frequency during exercises. This combination of higher tidal volume and increased frequency leads to a significant rise in minute ventilation, which is the total volume of air entering the lungs per minute during both submaximal and maximal effort. Other than that, it also can improve gas exchange efficiency. Exercise training enhances the lungs' ability to facilitate gas exchange. Number 1. Increased surface area. A lot of training can lead to an increase in the number of alveoli and capillaries, improving oxygen uptake and carbon dioxide removal. These adaptations allow for a more efficient exchange process, which is vital during high-intensity activities. Number 2. Strengthen respiratory muscle. The diaphragm and intercostal muscle, which is essential for breathing, becomes stronger and more endurance capable with regular training. This results in more efficient breathing, which is stronger respiratory muscle allow for a deeper breath with less effort, reducing fatigue during prolonged exercise and enhanced muscle endurance means that this muscle can sustain high level of activity without tiring. Lastly, it will affect the aerobic condition in the body. These adaptations also improve how effectively the body uses oxygen, such as in increase of O2 intake. Regular aerobic training increases maximal oxygen uptake, which is a key indicator of aerobic fitness. This improvement results from enhanced cardiac output, increased capillary density in muscles, and better respiratory function. Increased anaerobic threshold. With improved oxygen delivery and utilization, athletes can perform at higher intensities before reaching their anaerobic threshold, allowing for more duration of high-intensity exercises.
Next, we move to the impact of specific conditions. For the first one is exercise-induced asthma, EIA. Pathophysiology. Exercise-induced asthma involves airway narrowing during or after exercise due to inflammation, dehydration, or exposure to cold or dry air. Adaptations. Athletes with EIA may hyperventilate or adopt a shallower breathing pattern to avoid exacerbating symptoms, but this can limit oxygen delivery. For the second one is respiratory muscle fatigue. It is caused by prolonged high intensity exercise that can lead to fatigue in the diaphragm and accessory respiratory muscles. And for the impact is the fatigue reduces ventilation efficiency, contributing to early exhaustion. And for the last one is altitude training, hypoxia. Training at high altitudes exposes athletes to low oxygen levels, stimulating erythropoietin (EPO) production and increasing red blood cell count. Ventilatory adaptation. Respiratory rates and death initially increase to compensate for hypoxia, but athletes eventually adapt with improved oxygen utilization.
Strategies to optimize respiratory function. 1. Exercise induced asthma. 2. Respiratory muscle fatigue. And last, altitude training. Exercise induced asthma. 1 is prevention. Use of bronchodilators before exercise, avoiding allergens or cold air. Number 2, warm up. Gradual warm ups can reduce the severity of bronchoconstriction. Number 3, breathing techniques. Pursued lip breathing can improve airflow. Respiratory muscle fatigue. Number 1, respiratory muscle training incorporates inspiratory and expiratory muscle training device to enhance strength and endurance. Number 2, educate recovery. Proper rest and nutrition like anti-inflammatory foods can help mitigate fatigue. Altitude training. Number 1, live high, train low. Athletes live at high altitudes to increase red blood cell production but train at lower altitude for intensity. Number 2, gradual acclimatization. Spending 1 or 2 weeks at altitude before competition reduce the risk of acute mountain sickness. Number 3, oxygen supplementation. Using supplemental oxygen during rest or high intensity sessions can improve training outcomes.
Next, we are going to proceed with general strategies. The first one is by using nasal breathing. By using nasal breathing, we can encourage better air filtration and humidification and reducing respiratory stress. Other than that is hydration, which is used to maintain mucosal integrity and reduces the risk of airway irritation. Lastly, strength training. By doing strength training, we can incorporating core and postural exercise aid respiratory muscle efficiency. After that, differences between male and female in determining exercise intensity. So, based on the data given, we can conclude that female had higher heart rate than male at low and high workload. Other than that, female had also have the higher percentage of heart rate than male in all three workload that given to them in figure 2. In conclusion, understanding these physiological adaptation and tailoring training strategies to individual needs can enhance respiratory efficiency and overall athletic performance. Athletes dealing with specific challenges as exercise-induced asthma, EIA, or altitude training must adopt preventive and adaptive measures for optimal outcomes.